All right, welcome back to the San Diego Spotlight, where we shine the light on the most influential businesses around town and keep you informed and empowered as a consumer here in our lovely San Diego. We are here today with Dr. Albert Lin and Dr. Robert Gramins of Boulder OMS and La Jolla Oral and Facial Surgery. They have locations in Poway and our lovely La Jolla. So, gentlemen, tell us a little bit about your industry. What are some of the challenges that you're facing right now?
Well, I mean, right now there is particularly something on the legislative front that is potentially affecting all healthcare providers, and that's Proposition 46. Kind of in a nutshell, Proposition 46 is a proposition that is known as sort of the what we call the anti-micra proposition. MICRA, for those of us who aren't aware of what MICRA is, was a bill or statute that was invoked in the 70s regarding trying to lower medical malpractice liability insurance premiums for healthcare providers by decreasing the caps on tort litigation and damage. The problem that they were having in the 70s is that the doctors who had issues and who were being sued, if they lost those cases, the payouts were extremely high, to the point where it was driving insurance premiums up for the healthcare providers, to the point where healthcare providers couldn't even afford to pay their premiums anymore and couldn't afford to practice then. And in the end, the only people that really lost, most importantly, were the patients, because there were no providers to provide care anymore. So this prop right now is trying to again raise the caps on MICRA, and they've tried multiple times over the last few decades with no success, but right now they're trying again to almost essentially quadruple the caps on litigation and damage, tort litigation damage, which would drive insurance premiums for healthcare providers through the roof, and again all that would do was decrease the amount of healthcare providers able to work, who would want to work, and then in the end there's less patients, less doctors to take care of patients. So it's a big issue.
Well, God knows we don't need anything to make healthcare more expensive, and we don't need any more encouragement for doctors to be leaving the practice.
Yes.
You know, whether you support or oppose Obamacare, we all know that it has had a strong impact on doctors, and there are doctors who are leaving the practice because of it. What do you think about that, Dr. Gramins?
I think our new location would be in Texas. I'm joking.
Go back to hot.
Gotta stay hot.
We're going to secede from the union.
No, I mean that's not totally out of the spectrum. I'm friends with several healthcare providers who were like, "We're out of here," because if your healthcare insurance, you're paying $100,000 now, and it goes up to $400,000. That's a lot more money you have to make just to cover, your ability to practice, because you have to have malpractice coverage. So it's really penal. And this being said, that the awards being made in cases like this, because I do expert defense testimony as well, they're appropriate for what's going on if there is truly a problem in a case. It's not like the lawyers are hurting for anything.
Right.
So, it's just a way for them to be able to file more suits and get quicker settlements, because there'll be a threat that you could go to trial and lose a significant amount of more money. So it just prevents the frivolous lawsuits from being invoked on us.
Well, what do you think the chances are of it getting passed this time around?
Well, I think that right now there's obviously a huge movement in support of being against Prop 46, including the California Dental Association, including the California Association of Oral and Facial Surgeons. We're all on board and trying to defeat this proposition. But, I think the most important thing is that we need public awareness of what this proposition really means and what it means to their health care in the end. And in November, they need to vote no on Prop 46.
Did you hear that? He's talking to you right now. If you don't know what Prop 46 is, go to the internet, look it up, understand what it's about before you vote on it, and I know I'll vote no. You've got my support, gentlemen. So, again, we don't need anything driving up the cost of health care, and we don't need any more opposition for doctors as it is.
Yeah, in fact, if you go to Prop 46 on the internet, and there's actually a video right now that has been created by doctors and medical students talking about Prop 46 and what it really means and how it really affects healthcare in the future if it passes. So it's important to look at that.
Okay, well, we'll share that on our website and also our social media feeds for any of our listeners out there who would like to learn more about that. We'll make sure to get that information to you so that you can vote no in November and keep those caps in place and help support our doctors who desperately need your support. So switching gears a little bit, tell us what else has changed, what's new and different, what's fresh, what excites you about your industry?
Well, I mean, right now, I think the most kind of refreshing aspect of our field is still dental implants and its ability to restore lost teeth permanently. They look like real teeth. They function like real teeth. And the reality is that they're starting to outlast real teeth too.
Oh wow!
Because they're titanium metal. So the experience so far with dental implants has been amazing. I mean, beyond that, obviously we are branching out to other things that we're trying to do, like the facial cosmetic surgery. Those are all things that are new and exciting for us.
So, do you brush and floss implants like normal teeth?
Yes.
You do?
Yeah.
Okay.
You can take care of it like a regular tooth. We don't like it when you like power floss around them or anything like that.
Okay.
If you use a water pick around an implant,
Okay.
that's actually preferable in most cases. So, but the dentist usually takes care, or the hygienist usually takes care of the cleaning and the care of an implant after we put it in. We check on people a year out just to make sure there's no problems. I mean, rarely you can get periodontal disease or gum disease around an implant. A lot of times it'll manifest itself within the first year. So we check on people and make sure everything's okay. And then as people go on from there, they're seeing their regular dentist for care.
So they do still see a regular dentist to get them cleaned?
Oh, absolutely. Yeah.
Okay. And you mentioned mentioned periodontal disease.
Mm-hmm.
Now, you can get that after, but I'm sure that's probably pretty rare. But what about people who've had that before they get implants? Can they still do implants?
They can still do implants, yeah.
What do you do to correct or cure that?
Well, first thing you have to do is they have to get their mouth cleaned up before we do the surgery. And then a lot of times what we need to do before we put the implants, and we touched on a little bit earlier, is we need to do some grafting procedures. A lot of times we can rebuild bone and rebuild the jaw. We can also rebuild the gum tissue that goes around an implant.
You can?
Yeah, we have all kinds of different things we can use. And one of the newer things, actually, that I've been doing, I just did a case last week, is using a bone protein where we can actually rebuild the facial bone structure with a protein that we put in there.
That is incredible.
And it comes in a little gel, and we put it in a little mesh that we shape to form the new bone that we want it to look like. And then it's a recombinant human protein that grows bone.
Wow. Now, how long has that been around?
It's been around for, I think, 4 or 5 years
4 or
now.
5 years
Oh,
now.
wow.
They used it in orthopedic surgery and neurosurgery in the past, and we just got approval from the FDA in the last few years to use it in oral surgery.
Okay, yeah, see, I didn't even know things like that existed. I'm sure a lot of our listeners don't.
Right.
And I can imagine, is that one of the biggest challenges you face in your practice, is informing people about who you are and what you do and how you do it?
It's one of the hardest things that we face. So,
Yeah.
I spend all kinds of time explaining my profession to all different kinds of people.
And do you find that even people in the medical profession maybe don't understand entirely what you do?
My brother's a heart surgeon, and he doesn't even understand what I do. He's getting it now, but it's been years.
So the holidays are fun, is what you're trying to say?
Yeah.
So, and you said they last forever. I mean, they really, truly last forever?
I mean, some of the implants they put in the 80s, I'm still seeing in La Jolla, because that was one of the first places where people were putting them in.
Wow.
So that's, 35, 40 years in some cases.
I mean, the stats coming back are so positive right now for dental implants and their long-term success rate that these implant companies, a lot of them are starting to guarantee their implants for life.
Mm-hmm.
Wow.
And they would only do that if they know that the stats are that good. So, I mean, the implants that we use, the companies guarantee for life. So, for some reason, if something were to happen, these implant companies are replacing implants free of cost. So, it's that predictable.
So what about veneers? Like, do you see people that would rather do this than veneers? Because veneers, you have to replace them and keep them updated all the times.
I think you're talking about a bridge. A bridge would be like a porcelain thing that spans an empty tooth spot with a fake tooth in the middle. A veneer is like something you just put on your regular teeth. But a little bit older treatment was the bridge, and in some instances they're still fine, but more and more we're moving to doing implants to replace a tooth, so we don't have to destroy the teeth on either side.
Okay, yeah, okay, bridges, yeah. And also you have some other warning signs that you look out for people who might be needing teeth replaced?
Well, I mean, aside from chronic periodontal disease, and just to sort of clarify, periodontal disease is when there's been chronic inflammation in the area that actually starts the bone to kind of resorb and you get bone loss. And that's why Dr. Gramins was talking about bone grafting and trying to grow bone through using proteins. But I mean, other things that are kind of red flags that we're always looking for are gingivitis, which is inflammation of the tissues. That's redness and swelling of the tissues. The bone underneath, if left long enough, starts to resorb, and that's periodontal disease. But I mean, those are things you look at occlusion and the way teeth come together. If occlusion comes together in a non-desirable fashion or a traumatic fashion, those are all things that can affect the longevity of natural teeth, and those people might be heading for something like dental implants down the road. But that's something that our general dentists are keeping an eye on throughout the patient's dental care.
Okay.
Yeah, pretty much anybody can pretty much now get an implant. There's really no huge contraindications to getting them.
Young, old, tall, short.
I put an implant in on a 95-year-old.
Oh, wow.
He's like, I want to die with all my teeth. So I was like, all right.
Is the recovery time a little bit longer for someone of that age?
Surprisingly, not really.
Really?
No.
Wow.
It's a minimal procedure in terms of invasiveness.
Yeah.
Recovery really is very straightforward, very 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 easy. There is one patient base that actually can't have implants though, and that's people who are not done growing skeletally.
Oh.
So the younger patients, you have to be done growing skeletally to actually be considered for dental implants. So,
okay.
If there's a teenager coming in who is missing a tooth or teeth that ultimately will need to be replaced with dental implants, we actually have to wait for them to finish growing skeletally before we can place those implants.
And is there an age guideline for
skeletal growth? For the most part, for men, it's usually in the late teens, 18, 19, 20,
okay.
21. For women, perhaps a little bit earlier, 16, 17.
Okay.
But generally, we kind of watch their growth patterns as they get closer to being ready for dental implants, and there's a kind of a time that we think is appropriate to put them in.
Okay. All right, well, we're here with Dr. Albert Lin, Dr. Robert Gramins of Boulder OMS and La Jolla Oral and Facial Surgery. Stick around, we got more stuff to talk about.